welcome to Public Health Live, the third Thursday breakfast broadcast. I'm Rachel Breitster, and I'll be your moderator today. Before we get started, I would like to ask that you please fill out your online evaluation at the end of the webcast. Continuing education credits are available after you take our short post-test, and your feedback is helpful in planning future programs. We encourage you to let us know what topics are of interest to you and how we can best meet your needs. As for today's program, we will be taking your questions throughout the hour by phone. Our toll-free number is 1-800-452-0662, or you may send your written questions by email. Please email us at any time throughout the hour at phlive.ny@gmail.com. Today's program is Crossroads, the Built Environment, Health, and the New York State Prevention Agenda. Our guests are Dr. Nathan Graber, the Director of the Center for Environmental Health at the New York State Department of Health, and Karen Derusha, the Principal Public Health Educator at the Health Planning and Promotion Division at the Clinton County Health Department. Thank you both very much for being here.
Thank you. Good morning, Rachel.
Good morning.
Great to be here.
So in the title of our presentation, we have this term built environment, and it's sort of become almost a catchphrase for urban planners. So can you just start by telling us, what do we mean when we're saying the built environment?
Well, I mean, just because it's a very popular term today among urban planners doesn't mean that the connection between the built environment and public health is actually a new concept. You see, the way cities originally kind of developed, they were sort of organic. They developed around centers of trade and commerce. People generally lived and worked and had social centers in the same sort of area, very close to each other, in close proximity. So, but what happened as a result of that is that cities became very crowded, housing became overburdened, and so you had more thought being put into how to develop cities, mainly to address a lot of the public health issues that were taking place. So this goes back, hundreds, maybe even thousands of years, where the grid structure to try to increase the opportunity for people to be able to easily transport themselves and goods across the city, also transformed into public health infrastructure improvements that address the major killers of the day. So in the mid-19th century, people were dying from contagious diseases. So what were some of the major influences that addressed those contagious diseases were actually clean drinking water, safer food, sanitation, so there wasn't garbage strewn out around the streets, better housing, so housing that provided for appropriate ventilation, safer heating systems, and actually it's very interesting because urban planners, even at that time, had public health in mind. So you think of a good example like Frederick Law Olmsted, who built parks in the center of large urban areas as a way to be a clean space for workers to not just get some fresh air, but also to relieve their stress and improve their mental health and well-being.
So you're talking about sort of a historical perspective and the way that cities developed, and certainly that infrastructure and those things you talked about exist today in cities around the world, but we have a lot of people now that grew up in and live in and work and play in areas that are outside of cities. So can you talk to us about what influenced the development of those kinds of places?
Right. So what happened was with the sort of rise of the automobile and the infrastructure that supports automobile travel, people realized that they could live further away from where they worked or went to school and became dependent on their automobiles for transportation. And this also enabled these large expanses of track housing that were uniform in a lot of different ways. Well, that has a strong influence upon public health as well. And I'll talk about some of these influences. If you have uniform housing, people don't need the same type of housing throughout their life cycle.
Sure.
So if a community only has one type of housing, they generally have people in the same sort of stages of life. They connect with each other and form social networks and social support systems. But when let's say their kids grow up and they have to move out, there isn't a small apartment for them to rent in the neighborhood, so they leave the community, they lose that social network. And then when older adults want to downsize from their home, they leave that community, they leave that network, so they don't have the same social connectivity that they had before. In addition, the way that these communities are designed, you can't easily get from point A to point B, from the place where you live to the place where you work or go to school, with anything but your car. And so you become dependent just on your car. So active forms of transportation like walking or biking just aren't options when you have to go out to a main feeder road and then take that feeder road to get to your school, or get on a highway for half an hour to get to your work. In addition, these communities don't necessarily have any place to really even walk to if you wanted to do it, not just intentional physical activity, but also physical activity that would, during leisure time. So if there's no place to really go that's nice to look at or pretty or something to see, then chances are you're not going to go out and spend time walking around the neighborhood.
Sure.
Yeah.
So now, to this point, we've been talking about the development of neighborhoods, whether it's a city or a more suburban kind of setup, but the built environment encompasses other things too, does it not?
That's right. And so the built environment is everything from the chair that we're sitting in right now, okay, to the room that we're in, to the building, to the larger community that we're a part of, to the city, to the community, to the village, to the region, to the county, right? It could be at any level, and all those different levels can influence people's health behaviors, right? And so when we think about our built environment, we think about how the structures in it influence things that would either positively or negatively influence health outcomes. So things like physical activity, nutrition, and social capital, and even exposure to nature can have impacts on health. And so, I'll just give a couple of really just quick examples. So if we think about like small scale, like in a building, all right, so when you walk into a building and you have to get to another floor in the building, are the stairs accessible, or are they difficult to find? Are they enticing you to walk up them instead of taking the elevator?
Sure.
So just, certain examples. You walk into a supermarket, and what are the food choices that are most affordable, most accessible, right there in front of you that influence your choices in terms of what you're going to buy? Sure. Yeah.
Can you talk a little bit more about some of the specific characteristics or components of the built environment and how that influences behavior?
Sure. So the built environment can provide you with lots of options or not a lot of options. And so it's it'd be an interesting exercise just to kind of walk around your community and take a look at all the different components and how that might influence the way that you think or act in your own health behaviors, but also look at how it impacts on the larger community as a whole. So things like whether there are sidewalks, bike lanes, bus shelters and greenways, destinations and places to go, streetscapes, the way that a sidewalk is surrounded by something that's beautiful or something that's ugly, and it might influence your decisions about how you're going to use it. Also, just zoning laws. So like zoning laws can influence the way a community has, what resources are in the community. Can it be mixed use? Is it all housing? Or is it housing, stores, centers of community engagement and community congregation? And those can influence also people's health behaviors. Other things, that can influence health behaviors, things about access to sort of parks and recreation, access to green spaces, which we know have an influence on mental health and well-being, as well as opportunities for physical activity and social engagement, accesses to healthy food, and also those real barriers that we're talking about, whether you can walk somewhere or not walk somewhere, but also the perceived barriers.
Sure.
People's fears about their safety or the safety of their families when they go out into the street. Those are also important components of the built environment.
So certainly you've kind of made the case that the built environment encompasses a lot of different factors. Can you say more about the connection between the built environment and the health and well-being of the people and communities?
That's right. So I guess the point I want to bring up here is that a lot of this is common sense and a lot of this is anecdotal, but it's not entirely it's not entirely anecdotal. It's not entirely common sense. It's actually evidence-based. And there's a growing body of evidence in the scientific and public health literature pointing to the real benefits of designing built environments to improve health. So for instance, there was a study that was published back in 2003, and they looked at something called the sprawl index, which was a measure they made up, which took into account things like mixed land uses and residential density and centers of activity, and compared communities that had a high sprawl index, which means that they're low in opportunities for better health behaviors, versus communities that have a low sprawl index, which means that they're sort of higher, denser communities with abilities to have better access to healthier foods and physical activity and other positive health behaviors. And what they actually found was that people who lived in the residents with high sprawl indexes, they weighed more, they were more likely to be hypertensive, and they were actually walk less during their leisure time.
Well, and that makes sense given everything that you've said. So, are there other examples of how the built environment can either promote or detract from a healthy lifestyle?
Oh, sure. So I'm a pediatrician, right? So I would tell my patients if they were overweight or obese or at risk for overweight or obese that there are things they can do in their own home to change their health behavior, right? For instance, if they ate ice cream every day because they had it in the freezer, I would say, well, don't buy ice cream and don't keep it in the freezer.
Sure.
And this way you have to make a little bit extra effort to go out and actually purchase it. So there was an interesting study that was done in East Harlem, and in this study they actually looked at kids and where they lived and the location to convenience stores. So convenience stores, although they sell lots of options for different foods, the prominent options that will attract kids the most are those things like candies and other types of junk food and sugar sweetened beverages and things that aren't necessarily healthier for them if they eat these every day. And what they found was actually that the proximity to convenience stores was directly associated with their body mass index, which is a sort of a standardized measure of overweight and obesity.
Yeah, I mean, that makes sense to me too. Like you were saying, it's common sense because if the cookies are there, I'm going to eat them. If they're not there, you're not going to eat them. So that certainly seems like a logical conclusion. Now, another thing that we are hearing more about is climate change as it relates to public health. So can you talk about how the built environment plays into climate change? Right.
So we've I bring up this point for a couple of reasons, and I'm glad you mentioned it because the climate change not only has those direct impacts on public health, right? So, for instance, during heat waves, we know that, particularly older adults and people with chronic underlying diseases, that they're at risk for heat-related morbidity and mortality. And in urban areas that are, heavy in heat-absorbing materials, black tar roofs and asphalt streets, they hold the heat a lot longer, and the temperature can actually be higher in this local environment, increasing that risk for heat-related morbidity and mortality among the people at risk in those communities, and that can actually spread. That heat can actually spread to the surrounding areas as well. The other thing that happens is that at night the temperature doesn't drop down, so there isn't even a chance for some relief from that heat. But so you have sort of these direct impacts from both the heat, and we know that also along with that, if you have the major transportation infrastructure is around automobiles, you also have a risk during that same time for poor air quality, which goes up with during heat waves, which can have also direct or indirect impacts on cardiovascular mortality and pulmonary mortality. And also, for climate change, there's also the issue of just storms and flooding and whether communities are resilient. I mean, social capital feeds directly into community resiliency. So I bring this up specifically because I want to talk about bring up the topic of some of the co-benefits. If you address issues in an urban area with related to climate change, you're also addressing a lot of the public health concerns associated with the built environment and people's health behaviors.
And what are some of the other impacts of the built environment on health when we're looking kind of at the big picture?
Right. So I think, just to kind of sort of bring it all together, I think there are, of course, impacts and risk for exposure and options and choices at all different levels of the built environment, and we spoke about that already. And some of those impacts can be direct, like, for instance, houses or housing where there's maintenance deficiencies, and so it's poorly maintained older housing, could put kids at risk for lead poisoning, for asthma exacerbations. Outdoor air pollution can put people at risk for asthma exacerbations and cardiovascular disease. So some of these are very direct, some of them are indirect. So for instance, the built environment structures like the access to places to walk to and sidewalks and bike lanes and opportunities for physical activity, and an indirect impact that if they have that choice, if they don't have that choice, then they don't engage as much in physical activity, and there's a higher risk of cardiovascular disease, hypertension, stroke, diabetes, osteoporosis, which the risk goes down with increased exercise, risk for older adults and falling if if the outdoor structures are built in a way that the sidewalks are well maintained and there are well marked and easily visible curbs, the risk for falling among older adults goes down as well. So there are these indirect, there are the direct, and then there are some very complex relationships. And what I think is really interesting is that in the built environment, you have the opportunity, by addressing design in the built environment, by addressing maintenance in the built environment, you have opportunity to impact on a lot of health outcomes in a very comprehensive way by preventing them in the first place.
So certainly you've given us a lot of examples, and whether we're talking about things that seem to be common sense or now we know that it's evidence-based, certainly the built environment, we can all agree, contributes to public health. So then my question is, what is New York State doing about it? What are we doing in relation to the built environment?
Right. So I think a lot of people are familiar with our prevention agenda. If you're not, this is New York State's blueprint for public health actions, and it's a guide not just for us as a public health agency, as New York State Department of Health, but it's also a guide for local health departments, for community groups, for healthcare provider organizations, and one of the focus areas of the New York State prevention agenda is the built environment, and specifically to improve the design and maintenance of the built environment to promote healthy lifestyles, sustainability, and adaptation to climate change. And these can be used by local health departments, healthcare providers to develop health plans, like health improvement plans for at whatever level, the regional level, the county level, the community level. And I think one of the things that we want to try to do and break through with the prevention agenda in terms of the built environment is help these stakeholders to overcome some of the perceived difficulties with getting engaged. It's hard. I mean, this is something that's new for public health practitioners. It's different, and it's also hard because it requires engagement with stakeholders that we're not normally partners with.
Gotcha. Okay. So one of the ways that in public health we try to understand different interventions is using the Friedan pyramid. So can you talk about how that plays into how we might apply that to the built environment and public health?
Sure. So the Friedan pyramid, it provides a framework for how we think about interventions. And when we want to address the public health opportunities associated with the built environment, we want to try to engage at every level of that pyramid. At the very top of that pyramid is counseling and education. And so although it may have the smallest impact, it's important that we do that because we as public health practitioners want to engage with urban planners and architects and transportation engineers to educate them about the built environment. We also want to and opportunities to improve the built environment, but we also want to opportunities to teach kids about improved physical activity and have community-based physical education programs both school and at the workplace. And one very good example that's evidence-based is a simple educational tool, which is something called a stair prompt, where you put a sign up next to the elevator encouraging people to take the stairs instead of walking up, instead of taking the elevator to get more exercise. And actually evidence has shown that this is effective.
Okay. Are there any other examples of how clinical interventions relate to the built environment that you'd like to share?
Absolutely, and I think as physicians we want to lower people's blood pressure or improve their diabetes, so we give them medication to do so, and that's the classic clinical intervention. But at the public health level, some of the things that we can do is, well, we can write, as a physician, I can write a prescription for exercise and to go out and use your parks and use the resources in your community for opportunities for healthier living or better nutrition or social engagement, whatever it is. And
is that something that physicians are actually doing? I mean, are physicians writing prescriptions for exercise?
I think that's a really interesting question, and I'd say that it's probably not within the classic model. So they think about writing prescriptions for medication, something we'd like them to do, and I think would be fantastic. And also, another is how we apply the data that we have through tracking and surveillance to improvements in the built environment and to help organizations at all levels, of both government and in the community, to make improvements.
Excellent, thank you. Now, we met with Melissa Frisbee with the New York State Department of Health, Bureau of Environmental Health and Occupational Epidemiology to learn more about data collection and assessing the built environment. Let's take a look.
In New York State, we have a series of ATSDR-sponsored brownfield projects, which we sort of work with communities to identify their health concerns and focus on their priorities in the health area in regards to the land redevelopment and reuse. So a health indicator is a measurement of a population's health. It helps us to determine how healthy the community is, and it helps us to establish a baseline of community health. These indicators in our communities, we're looking at the communities from a little bit of an atypical public health lens. We were looking at traditional public health indicators, but we were also incorporating more broad indicators that are maybe a little bit non-traditional, but are really crucial when you're trying to assess the built environment. Non-traditional indicators are sometimes the harder ones to collect, but they're absolutely crucial when you're assessing the built environment. For example, crime is very important when you're assessing the built environment. Certain community designs, such as lack of lighting, that kind of thing, lead to more crime. You have green space. Park just like this one is very important to community design in the built environment. Different indicators like community walkability are also important. How safe are the sidewalks? Food access and food deserts. These are things that are really crucial for the built environment. So Photo Voice is a unique tool that we've used in several of our communities, and it doesn't necessarily collect traditional data, but what it does is it helps communities prioritize what kinds of concerns they have and what kinds of data you might need to look at. So Photo Voice uses the power of pictures to create change. We ask the community to identify, what they think is the strength of their community, what they think they'd like to change. We did a Photo Voice project in Rome where they were mostly concerned about absentee landlords and the condition of housing and trash in yards. And what they actually found in doing the pictures and taking the pictures for their Photo Voice project was that their sidewalks were in really bad repair, and that was one of the things that we jumped on from there. Community participation is essential when you're assessing the built environment because it's their environment. They live there, it impacts their health, they're there every day, it's their day-to-day living. Empowering them in the process of assessing the built environment really can help bring about positive changes that affect them. So you should be consulting someone. If you're going to be assessing the built environment, why not get feedback from the people who are using it day to day? So the biggest obstacle that we've faced in almost every community is a lack of resources. Projects to assess the built environment, especially ones that require a lot of on-the-ground data collection, are expensive. So we've encountered that as a big obstacle. We've tried to address these obstacles in the most feasible ways possible. Lack of resources is hard, but what we've found is that when you bring the right people to the table, you're able to accomplish a lot of small changes, and those small changes lead to bigger ones. Some of the other indicators, such as health outcomes, might be a little bit more difficult to get at the community level. The DOH always has health data available, for example, asthma online, but it may not be at a fine scale that you need to assess your community. So I would like to emphasize that it's really important to bring in your local and state health partners in order to get access to key data sets. But also, the ATS-DARE action model is developed around engaging communities in the process of land redevelopment, which is specific, but it's very related to the built environment. So I think the action model would be really great to check out. I also think the CDC has a Healthy Homes checklist that's really great. It lists a lot of key data sets. They may not be at the community level, but it's a great idea of where to start looking. It's just a really great asset when you're looking to assess your built environment.
So certainly that was, I think, a really great piece of information talking about the importance of assessing the environment and looking at the different ways that neighborhoods are utilized. Now, one of the things, thinking back to your roots in New York City and utilizing park space and open space, talk to us about the project where they did the gates in Central Park. I know that was some years back, but can you talk about that?
Well, yeah, I'd like to actually, because I think that's a really great example of where you have an opportunity to break down some really, some sort of perceived barriers about what resources are available. So when you have like a public art display like the Gates in Central Park, which was in 2005, which was a fantastic display, drew people from all over the world and also people locally to come out to use a park that now gets millions of visitors. I wouldn't say this was the turning point for them, but there were a lot of things, factors that went into it. But these types of public art displays and also things like play streets where you close off a street for part of the time of the day so that kids and families and everybody can get out and utilize resources that are already there. So we're not necessarily talking about creating something new, but we're talking about connecting people to those resources that already exist in their community and their neighborhoods.
Now, can you talk about some examples of interventions that might have longer lasting effects?
Sure. And so as we move down the pyramid, right, we get to the level of sort of the opportunities to do something that could have a longer impact. So one of the ways you could have a longer impact is through enforcement. You could have enforcement at the building level. So for instance, codes enforcement for maintenance deficiencies in the home. And you could have at the community level, so sort of engagement and working with policies that could be at the county level, at the city level, or at the state level, such as smart growth infrastructure and complete streets that could also have longer lasting protective interventions that will be around for a while. Other things, we talked about, I like to mention sort of perceived barriers a bit, right? So crime is a perceived barrier for folks, either using their stairs in their building or using the community resources, getting out into the street more to get more exercise or travel a little bit further to get healthier food or whatever it is. So we shouldn't forget that sort of innovative policing strategies are also an important public health intervention in the built environment.
Now, can you tell us more about changing the context of the environment and how that impacts choice or perceived choice?
Right. So this is, I think, where environmental public health has had its best, impacts. Right. So, for instance, the development of drinking water systems into communities, virtually eliminates waterborne diseases in those communities. It's fantastic, and people don't have to think about it. They just go to the tap, they get a clean glass of water every time they go to the tap. And the idea is, can we do that with the larger built environment? And the answer is absolutely yes. Right? So if you design the environment so that you have accessible sidewalks and you have accessible bike lanes and you have beautiful streetscapes and you have amenities, particularly in sort of low-income communities, that public transit is readily accessible, and that works better in higher density neighborhoods that can support it. But what do you do for the lower density? Can we do that as well? Can we ensure that people have options and access to these things? Also, sort of land use planning and response to local needs. So you think about it, right? So exposure to nature has very positive impacts on mental health and well-being, opportunities for physical activity. Evidence shows that people recover faster from surgery and from illness if they have exposure to green spaces and green environments. And so we have to think about all sorts of uses around so that we can sort of change, also to kind of change social norms, right? So people think about changing like the way, so they don't automatically, when you want to get to the supermarket or go shopping or take your kids to school, that you don't automatically jump in the car, that you sort of say, oh yeah, it's okay, everybody walks their kids to school. And can you do that? Well, the infrastructure has to be there for the opportunity to do that, but also everybody around you has to, sort of, engage with you to make it sort of like the normal thing to do. And one of the ways you do that is a lot of these sort of changing the infrastructure also changes opportunities for building social capital. Now, I brought up social capital before, but I didn't stress just how strong the evidence in the literature is regarding the inverse relationship between social capital and mortality. People live longer lives, live healthier lives when they have stronger social support networks, when there's community trust, when there's enough social engagement so that information flows and they create better and healthier beliefs that engage with the sort of social norms. And also there's a better connection to resources with an improvement in social capital. And all these things, they influence how healthy people are.
Excellent. Thank you. So it sounds like our built environment choices have a big impact on the health and the health of our communities. Tell us about some of the approaches that work to address this.
Right. So I'll just talk very briefly. There's the Community Guide for Preventive Services. They do evidence-based, systematic or critical reviews of literature to determine whether there's sufficient evidence to recommend particular types of interventions that are going to improve health. And they looked at built environment to improve physical activity. And what they found is not just does it work at different levels, at the neighborhood level and at the larger scale, larger geographic area level, to make improvements in the design of the built environment that result in physical activity, but they also have lots of co-benefits. And those co-benefits include all those things that we've already been talking about, improved consumer choices for both places to live as well as places to go shopping and types of food, increase in social capital, increase in access to green spaces. But we have to think about a lot of the different programs and opportunities that are out there. So there's climate smart communities, there's complete streets, but there's also something called smart growth principles. And smart growth principles take into account there are 10 smart growth principles. I'm not going to list out the 10 smart growth principles, but basically it's mixed land use, mixed housing, increased density, transportation options, parks and public spaces. Right now, the issue is that is public health. Like I said before, this is new, this is different, this is hard for public health professionals to get involved in. Hopefully Karen's going to make everybody feel better about it and see how successful it can be. But public health needs to be engaged in at the table to help inform these decisions, and there are definitely ways to do that.
Great. So let's. We had a chance to meet with Paul Beyer, the Director of Smart Growth with the New York State Department of State Office Planning and Development, to tell us more about the principles of smart growth and show us some examples.
A health impact assessment is a full assessment of all of the elements that go into planning a community and the effect that they have on different public health and mental health outcomes. In New York State, Niagara County and Rochester have actually incorporated health impact assessments into their community planning. In Rochester, their local waterfront revitalization plan has a health impact assessment built right into it. Health impact assessments, I believe, can have their greatest positive impact on underserved communities and also in downtown settings, either existing downtowns that are revitalized according to the principles of smart growth, or new communities that are trying to build in a more healthy and smart and sustainable way. The principles of smart growth are really based on some of our most cherished communities that were built and planned in the early 20th century. Basically urban form, village form planning that incorporates neighborhood friendliness, pedestrian-oriented design, bicycle-oriented, transit-friendly design, a mix of different housing and a mix of different land uses. Smart growth really comes down to compact, mixed-use, walkable, diverse, and varied built environments. The very basic and most obvious translation of smart growth into public health is creating an atmosphere where people feel safe and comfortable walking or bicycling. Most suburban communities, typical of conventional sprawl, are not walkable and they're not bikeable. You have to access all of your daily amenities by car. We're standing right here in what is referred to in the smart growth world as an EDS and MEDS environment. This is an environment that's built up around EDS, which are educational institutions, and MEDS, a medical institution. So it's perfect that this environment would be developing in a smart growth way because you're not only creating public health outcomes, but you're standing in the shadow of a public health institution. Through Governor Cuomo's New York Rising program, we saw a number of plans that are coming up from the bottom. This is called bottom-up planning, as opposed to handing down plans from above, from the state government or from the federal government. Governor Cuomo went out into the communities and asked them what would work for them to not only create more storm-resilient communities, but more livable communities. And what has happened from that bottom-up process is that there's a call to create more healthy communities. The United States Environmental Protection Agency has come out with research in the last decade that shows that density in targeted locations can actually reduce the amount of stormwater runoff pollution that occurs in a normal sprawling environment. Whenever it rains, stormwater runs through what we call typically gray infrastructure, roads and gutters and treatment plants, and along the way it picks up contaminants and pollutants. If you densify in one area and preserve land in other areas, you can actually channel water more naturally, stormwater more naturally, so that you avoid some of those pollutants that our stormwater picks up. One of the attractive features of smart growth is that the formula applies to any setting, whether it be rural, suburban, or urban. We're standing in a fairly urban setting here. Some of the buildings are 3 and 4 stories high, but you can recreate this model on a smaller scale in any rural hamlet or village throughout New York State. There are many communities in New York State that want to plan according to the principles of smart growth, but they need some help and they need some guidance, and that's what the state of New York provides. There are a number of agencies, including my own, the Department of State Office of Planning and Development, that can provide guidance materials to communities. The New York State Department of State houses a number of planners and planning programs like the local waterfront revitalization program and the New York Rising Community Reconstruction Program. So communities can call any number of agencies, including the Smart Growth Office at the Department of State, and be referred to a number of different resources and grant programs that help communities on their own, from the bottom up, plan according to the principles of smart growth.
So certainly a lot of information there about smart growth. Can you talk to us about how smart growth choices make a difference?
Right. So I guess Paul did a fantastic job in explaining that. I just say, briefly, we could just look at examples of where brownfields have been turned from something ugly like blight into a community asset just by decisions using smart growth principles, as well as just changing the beauty of a community. In addition to giving transportation options, just beautiful streetscapes and the way that can influence our health choices.
And the desire to be out there. What about how communities can foster more community gardens or healthy spaces and things like that?
Right. I think community gardens, if you look at them, are a great example of something that could be done at a local level that would take what was a garbage-strewn, overgrown, city lot or even a suburban lot and turn that into a real community asset where it changes the streetscape. It gives people opportunities to learn about healthier eating, and actually studies have shown that people who are engaged with community gardens change their dietary habits and actually wind up eating more vegetables and more fruits, even if it's not what they grew. It just changes in their dietary behavior. There's opportunities for physical activity and access to nature and green spaces, as well as increasing social capital.
Sure. Now, also thinking about choices that we make, I understand that you bike to work every day, including on this very cold morning. Can you talk to us about some of the ways that the built environment accesses the decisions to drive to work versus bike to work?
That's right. And I'm gonna relate an anecdote. Okay, so I don't bike to work every day. Most days I try to get there as often as possible, and I love it. And I love to walk or bike to places to do my errands as well. And I'd love to be able to take my kids to school also in the same kind of way. But when we have to get to school from our house, we have to cross over a highway, and there's a bridge there, and the sidewalk was sort of an afterthought, and it seems to be more to protect the trucks from hitting the fence at the highway than really protecting the pedestrians. And there's no crosswalks. So we actually did it once, and we've never biked again. I just didn't feel that it was a really safe option for us to get to and from school. However, I remember once I was walking to taking a little walk before a meeting down in Atlanta, and I was in this beautiful park, and I saw this amazing bridge, and I said, I can't help it. I know I'm going to be late for my meeting, but I really have to cross this bridge. I was just enticed to go across that bridge. So we should be thinking about how we create our environments so that it forces us to, or entices us or convinces us to make, to engage more in physical activity or eat healthier foods, whatever it is. We should be thinking in that same way.
Sure. Now, you mentioned that one of the focus areas for the prevention agenda is the built environment. So to what extent have counties, hospitals, et cetera, really embraced that initiative?
Well, I think, it's interesting because although very few local health departments and healthcare provider organizations actually selected built environment as one of their priority areas or focus areas for the prevention agenda, a lot is already taking place. And across the state, in terms of climate smart communities or smart growth communities or smart growth initiatives and complete streets and other even differently named similar opportunities taking place everywhere. And so I think it's important that the public health engage with those activities. And if they're already engaged, they should be taking credit for it. Remember, it's new, it's hard, it's different for public health. But actually, like I said, we have counties that are doing it and are somewhat making it look easy.
All right. Well, so thank you, Nathan. That's, I think, a great transition to Karen joining us today from Clinton County. You are one of the counties that's selected promoting a healthy and safe environment as one of your focus areas. So welcome.
Thank you. I'm glad to be here and glad to be able to talk about this built environment strategy, a couple of built environment strategies and projects that we've worked on. When we brought our community together around the prevention agenda to discuss which priority areas we as a community wanted to focus on, we heard a lot about concerns about rising obesity levels, concerns about chronic disease, concerns about safety of our seniors, falls prevention, mental health, and it kind of brought us back to how do we address almost all of those things. And the built environment just seemed to be the way to go. And we've seen in our community a lot of excitement and a lot of traction around the built environment. So very excited to be able to do this type of project.
Great. And one of your initiatives is the food access strategy. How is that related to the built environment?
Well, as Dr. Graber was explaining, the built environment is so broad. It is, we think of buildings, we think of roadways, but transportation infrastructure, making sure that people have the ability to get the things that they need to have in order to be healthy. So our food access strategy really was designed to look at how people in Clinton County and in particular our most vulnerable populations, how they're getting their food and whether they're getting foods that are affordable as well as healthy.
So can you also tell us more about one of the specific strategies that Clinton County is pursuing in terms of the built environment?
So we're focusing on increasing use of our Clinton County public transit system, which is a rural transit system,
Okay.
for people to get from their homes to the grocery stores.
Mm-hmm.
We know that quite a number of people within our county, it's a large rural county, we've got about 20,000 people located in the city of Plattsburgh area and the other 60,000 or so spread out around the county.
Okay.
So grocery stores are generally in the Plattsburgh area, and most people need to come into that area in order to be able to purchase groceries in a grocery store where there's a wide selection and variety, and they can make those healthy choices. And we also know that there are quite a few households that don't have access to a vehicle, and so vehicle access is really a social determinant of health that is so important in a rural county.
So it certainly seems like kind of a complex project that you're taking on. How did you start this initiative?
We met with our county planning office, who facilitates the Clinton County public transit system, and we looked at the bus routes. We looked at where routes are currently running and how people are able to access the grocery stores. We took a look at some of the different grocery stores and selected 3 to really focus in on. We realized again that people needed to, in general, come into Plattsburgh. 2 of the grocery stores that we looked at were right in Plattsburgh, but then we also have one in the northernmost part of the county that we focused on as well.
And what strategy did you use to find out who was using the bus to go to the grocery stores?
Right, because we needed a baseline.
Yeah.
We needed to know who was using the bus, who wasn't using the bus. So we did what we called stop audits. And basically those were counts of people getting on and off the bus and people getting back on the bus with their grocery bags. And we did that at these 3 locations. We had some help in that. The bus drivers from the CCPT were a great help in actually collecting that data for us. We worked with nursing students from SUNY Plattsburgh, who again did a large portion of that data collection, because it's just time consuming, and but very worthwhile, because now we do have a baseline that we can work from.
And so what did you find during that phase of data collection?
Well, one of the things that we found is that the bus in general, asset that it is totally underutilized, both for grocery shopping as well as in general. So we know that we can work to increase ridership. We know that we can increase the use of the bus system and advertise that more for grocery shopping opportunities.
And what did you do the next phase, phase 2? What did that consist of?
Well, once we knew that people weren't using the bus as much as we hoped they would be, we realized that we needed to know why. So we developed a survey that we could actually talk to people about their use or their not use of the bus, and how they're getting to grocery stores, and what it looks like in their household when they are looking to buy fresh fruits and vegetables. What are the barriers that they face, and one of which we know is low vehicle access.
Okay.
So we conducted those surveys. We actually, we've got a lot of partners out in the community, and we went to those sites, the Department of Social Services, Child Care Coordinating Council, our JCO outreach centers within the smaller communities, so that we were able to talk to people who would be able to use the bus if the barriers were gone.
And how did you decide who your target population was for this program?
Well, we looked at the USDA Economic Research Service, and from that we're able to determine that there are about 6,400 households in Clinton County with what's considered low income and low access to a grocery store. And of those, almost 1,400 have no access to a vehicle, or have no vehicle of their own. So this gave us some numbers to work with. We decided to do a 10% sampling of that population.
And so what specific interventions have you planned to increase the use of public transportation for folks to access healthier food?
Well, what we found, and we did not necessarily anticipate that the number would be so high on this, but over 50% of those who responded that they either know nothing or not enough about the buses to use them. They don't know what the routes are, they don't know what the fares are, or just in general how to use the bus. How does it work when you get on and off? So we definitely know that we need to do a marketing campaign to get more information out there about the buses. We also know that within our human services organizations and other groups that are actually working with these same populations, that there's a lack of knowledge about how to use the bus. So we definitely know that we want to just increase general knowledge of the bus routes and the bus usage. And then the other thing is we really need to promote the idea of grocery shopping in a grocery store and all the benefits of that, and that the bus can be used for that purpose.
Now, the question everyone always wants to know about is outcomes. So will you be able to measure whether or not this is successful?
Well, we plan to be able to measure that, because we did the baseline surveys, those counts, we'll be able to go back and repeat those efforts and actually see just an increased number of people riding the bus. As I said, by using the grocery bag measure, we can also determine which of those people are using the bus for grocery shopping.
Excellent. Now, are there other initiatives taking place in Clinton County that address the built environment?
There are, and there's one that I want to speak about in particular, because in our county, we found that people have really embraced this built environment idea and really make the connection between public health and all of the benefits of working on the built environment. And so we've had a lot of training on things like complete streets, and we had one particular citizen group that just kind of latched onto this idea and realized that they wanted to do something right in their neighborhood about a complete streets project. So they actually initiated a proposal for a road diet on a stretch of road just north of the city of Plattsburgh.
And so that road diet, I'm guessing, was in Margaret Street, I believe?
Margaret Street, yep.
So can you talk to us about what that project encompassed?
Okay. So Margaret Street, as it's leaving the city of Plattsburgh, is a kind of a mixed use. There are some condo apartment type residential areas. There's also some small strip malls, I guess you'd call them, where there are businesses located. On the corner, there's actually Georgia Pacific Paper Mill, so a large employer who's got a parking lot across the street, who has always had concerns about safety of their employees crossing over that street. There's a McDonald's, and one of the things that this citizens group learned, they call themselves PASS, which is Plattsburgh Acquiring Safe Streets, and they learned that McDonald's had a real concern about the safety of their employees because so many of their employees ride bicycles to work. And the road as it was 4 lanes with no bike lanes. So safety issue for the bicyclists and also safety issue for the pedestrians, because what would happen is the bicyclists would move up onto the sidewalk. So they covered a lot of bases.
So what did the road diet encompass?
So the road diet, if I can just backtrack a little bit, I want to just point out that the process that they used was to really engage everybody along that section of roadway and find out who was in favor of this, what the concerns were, get the support. They did a feasibility study which was supported financially by Georgia Pacific, contributed to that because they had such a vested interest. So it really became very much a community effort.
Great.
And what they were able to do was to do the feasibility study, take that to the City of Plattsburgh Common Council, and lay out a plan for them. And having a plan is a great way to get things done, because they did get the approval for it. They had a little bit of luck of timing that the road was about to be resurfaced anyway, so why not resurface it in a way that actually promoted health? The city supported that. And so now what we've got is 2 lanes with it's actually 3 lanes, 2 driving lanes with a center turning lane, 5-foot bike lanes on the side.
And then also, in addition to changing the lane structure, One of the things that I know you had mentioned was there's a bike box, or there's some other improvements that have been made too. Can you talk a little bit about that?
And I have to say, I didn't know what a bike box was until I saw the bike box.
Okay.
And it's actually just, it's green and it's painted at the intersection, and it's a place where the bicycle can go. When you get to an intersection, it's always hard because if somebody is turning right and you're the bicycle going straight, and they don't necessarily see you, but if you're in the bike box, they will. Or if you need to make the left-hand turn, it gives you that opportunity to do so safely.
Excellent. And has this project been finalized at this point?
It has, yes. And we found that the day that they opened the road, we saw people out there riding their bikes on it. It's really been enjoyed. It's a great project, too, because there are bike lanes that run through the city of Plattsburgh. And there's a bike path that's been in existence since the 1980s, the Karen Fleury Memorial Bike Path. But this is the section that connects the two of those, and it has never been safe until now.
Excellent. That's a pretty tremendous project that your community was able to accomplish.
We're very excited about it. Yes.
Well, thank you so much for sharing that information with us. Nathan, can you quickly reference if there are places that our audience can go for more information on this topic?
Absolutely. I mean, the web is filled with great information. CDC has information on the website. There's the Built Environment Institute and resources from the New York State Department of State and from New York State Department of Environmental Conservation and New York State Department of Health in our prevention agenda. And there are fantastic videos, presentations, all strewn throughout the web that provide the evidence that local health departments and health care providers can use to help promote these improvements to the built environment.
Great, thank you. So we have time for just a few questions from our audience. We'll start with a question for Karen. Your analysis of the use of public transportation to access grocery stores is very interesting. Was this undertaken exclusively by the local health department, or were there others who helped with the data collection and analysis?
As I said, the planning department facilitates the buses, and so we worked hand in hand. In fact, the coordinator for the public transit system was the chairperson for the committee that put this project together. And one other thing that I didn't mention actually is that when the data is collected and input, we're able to actually export it back out to him, and he's geocoding the data from the surveys, the food access surveys that we did. So we can actually see when people answered questions on the surveys where we're seeing the most concentration of certain answers to really give us an in-depth look at what's happening in the different areas of the county.
Now, you mentioned that road diets are a feasible built environment approach even in rural areas. Are there any other examples that you would share that work particularly well in rural areas?
I think that one of the things that we try to get across, because it is different in a rural area, is that it can be very simple. It can be a matter of making a wider shoulder can make a street complete, painting crosswalks. So there are a lot of kind of low-cost, low-key kind of steps that can be taken in rural communities that just improve that.
Anything you would want to add to that?
I just think what they're doing is awesome. I mean,
I agree.
Yeah.
I'm somewhat familiar with Plattsburgh, and I think it's fantastic that the community's doing that, and hopefully we'll see more communities taking that on as time progresses and people become more aware of these issues.
Yeah.
All right, well, that's all the time we have for questions today, so thank you guys both so much for being here. I think this is a lot of great information for our audience.
Thank you.
Thank you for having us. I'm glad to be here.
And thank you very much for joining us today. Please remember to fill out your evaluations online. Your feedback is always helpful to the development of our programs, and continuing education credits are available. To obtain nurse continuing education hours, CME, and CHES credits, learners must visit www.phlive.org and complete an evaluation and the post-test for today's offering. Additional information on upcoming webcasts and relevant public health topics can also be found on our Facebook page. Don't forget to like us on Facebook to stay up to date. This webcast will be available on demand on our website within 2 weeks of today's show. Please join us for our next webcast, Bridging Gaps, the Vital Role of Cultural Competence in Healthcare. I'm Rachel Breidster. Thank you for joining us on Public Health Live.